future of digital front door, in my perspective or my opinion, is where a patient would be able to come to one place, whether it's a web application or a mobile application, and able to get their whole journey together in one place. What do I mean by that? Basically, think about starting from symptoms. When a patient has any symptom, they go on a website or Google search, look for something, and once they find something, they may or may decide based on the response whether they should see a provider or not. If they want to see a provider, then the next question comes in whether they should do a teledoc or in-person visit, right? So what I see is that whole experience, starting from finding out their symptoms to getting well, everything in between should be part of digital front door. The reality of front door or patient experience today is basically disjointed, fragmented, full of friction, and a lot of frustration. What do I mean by that? I mean, think about when you have to go, get some doctor appointment scheduled, how easy or hard it is. I mean, you have to pick up your phone or call somebody, schedule that appointment, and then they give you appointment like 2, 3, 4 months out, or even more depending on the specialist you're looking to meet. And then once you go to a physician, then they prescribe you something that goes to a pharmacy, which takes time. I mean, if you don't have that organized, and then the lab work, if you need that is also disjointed. You have to carry a paper with you to get to those results done, and then those results are sometimes electronic sent, and sometimes you have to take it to the provider yourself. And then the follow-ups and all those things are all kind of disjointed with different systems. You have Epic system, the MyChart system, you have Amwell, you have teledoc, you have your pharmacy from Walgreens, CVS, and what have you, and then you have lab work from LabCorp or Quest or whatnot. These are all kind of all disparate applications or systems of provider which are in different applications and disconnected today. So the use cases which you have to think about, starting from the first journey of a patient, right? If you're gonna register a new patient, how does that journey start? How easy it is to get a patient registered securely without friction. What do I mean by that? You basically should be able to register patient with their basic information and doing identity proofing, because you want to make sure it's the right patient you're looking for, and kind of done in fewer clicks. What we have heard from our customers is, you have a lot of patient drop-offs because of all the questions, all the details they have to put in to get registration done. So that's the first use case. Then once you have the patient registered, what about how do they get access to their application securely and easily from wherever they are, from whatever channel they might be looking at, whether it's a mobile device, a web application, or even in the hospital or with the provider? How do they do that? And once they have access to that application, how are you giving authorization to different applications they need to be in? Whether it's a MyChart application, whether it's their pharma application or lab work, or transportation, or the instructions or anything they might be looking for is completely disjointed, but they need to come together. These are just some examples. For this to happen, what you need to think about is kind of have a full context. What do I mean by full context? Think about you were chatting with a nurse on your phone with some conversation about some symptoms you might have, and then you show up in the hospital or at the provider office. Why do we have to express the same details or share those details over and over again when we have already covered it up? For that to flow, that full context I talk about needs to happen. And that full context to happen, you need to have connected systems. Connected systems could be anything behind the scenes which the healthcare systems are using, Epic being one, imaging could be another, and your billing could be another, payer could be another system you need to connect to. And then once they're all connected, they need to have workflow, which is, pushing data or information to each other so that they know exactly what is happening in each system, and pushing the data and information which is relevant to each other. So ideal, secure, frictionless journey would look like, you can easily get onto the application, let's say a mobile application. You open up your mobile application with your Face ID, you're able to just sign in securely. And again, if there is risky place you're coming from, maybe there's another factor, because trust is very important. If patient doesn't trust how you are authenticating them, they're probably not going to use the application. If it is harder to sign in, they're not going to use it because they would not remember the password. So you need to think about, passwordless authentication and securely getting the user into their application. Once they're in their application, how would you be able to give them access to any of the application they need at that point? Like needing, understanding their context, understanding your patient, understanding whether you know your patient well or not, and that is going to be based on what they are looking for. For example, if they're looking for, let's say, a doctor for ENT, when they start typing, are you able to kind of find that doctor for them and look at the calendar, maybe schedule it for them, or give them options like, hey, based on your calendar and the provider schedule, these are some options you can consider. And by the way, I'm also going to look for extra time for your travel, so that is also considered in your appointment. And once that appointment is done, once the appointment is done and they go through that, what are the follow-ups from that appointment? Follow-ups could be, go pick up your medicine, or maybe that medicine is going to be delivered to your, doorstep, or maybe you need to get some blood work done. Okay, where that needs to happen, that appointment needs to be taken care of too. Automatically kind of getting that scheduled, or maybe somebody coming to your home to, get that appointment for blood work done too. And that information now going back to the provider for their review, and if they have any comments back, coming back to you in your application or your own mobile phone with instructions which are easy for you to understand, and then able to monitor what those instructions are you following it, are you getting better health or not. And then you can even further tie into your wearables, where your wearables are kind of creating all that data, how much exercise you're doing, for example, how's your blood rate, heart rate is working, what time do you wake up, what time do you sleep. A lot of different things with your consent, if shared with the provider, can better your health too. And by the way, as all these things, it's a continuous thing, it's a loop, and now your healthcare provider is always in touch with you with your healthcare information and proactively kind of reaching out to you if something is seen. Capabilities to do that, first of all, you got to think from identity. Identity is the core to connecting all these different systems. So once you have secure your identity of a patient, which is unique, clean, trusted, now you can start connecting to these different systems, because all those systems also carry their identities. Right now, I mean, John Doe could be John Doe 1, John Doe 3 in other systems. First of all, you got to consolidate those identities, match them up, clean them up, and then start connecting and provisioning from one central source, which is going to be your identity platform. So once you have the core identity platform set up, start connecting to these different systems, because that becomes your authoritative source and connected information, or the source of truth, to kind of create that experience we just shared. So DFT journey, first you have to start from, is this a strategic goal for your organization? As an organization, are you looking to improve your patient experience? Is that something important for you? Once that is defined, then you start defining, where is my current state? What is my experience today for my patient? And for me to get to that future state, defining that future state, the vision you want, and then working backward, like, what are the gaps today? What are the required capabilities I need? What is the roadmap I need to put together? And what is the plan approach to get there? The biggest challenge of healthcare, what we are seeing in the industry today, is interoperability. How these different vendors and these different product offerings or products out there are talking to each other. Are they able to share the information in a way which each application can consume and talk to? Are the systems open enough to kind of communicate with each other? Are they willing to do that? So interoperability is one of the key factors which we see is going to be critically important to be improved over time to make this a reality. Well, as you can see, it's patient data, and all the things I was talking about relates to patient data, very sensitive data. So access to data is very critical. So as a patient, you want to give control in their hands whom do they give consent to, when do they give that consent to have their data, and ability for them to pull that data back or consent back so that they don't have access. Because if patients don't have trust of the data they are sharing, this thing is not going to become a reality. And we need to make sure that data is secure, and that's why security is very important and starts with patient itself. You have to do some, interviews with your patients, kind of run some pilots. Hey, if you were given this kind of experience, what would you say? What would you like to experience or not experience in this kind of thing? So what we have seen is, customers are doing pilots into different demographic groups, different age groups, different types of customers. Because if you think about it, I mean, different users see technology very differently, and you want to make sure they are going to be available and adaptable to each of those, or at least most of them. But right now we see, I mean, this is something which needs to be thoroughly looked at. But essentially, if you can make technology as easy to use as possible, which other applications they're using and similar to that, I think there'll be a huge adoption. Well, I think this has been talked a lot. I mean, I'll say it. I think it accelerated the whole digital transformation journey in healthcare industry. I am personally very super excited because the change was needed. What COVID pandemic, taught us is like technology can help. Technology can meet the patient where they are. Technology can make hospital a reality with no walls. Technology tells us you could be, serviced or served anywhere you're in the world for most cases. And I think that that's a huge thing. I mean, that thought people had, like, oh, I have to be in doctor's office for everything that I need. I think that has been debunked. I mean, anything we do need to be measured. I would just say start looking at the patient retention rate, patient sign-on rate, patient registration rate, and how many new patients they're adding every month, quarter, year from when they started the digital journey. I think that'll be a key to see if this is a successful business proposition or not. So some of the mistakes we have seen is I mean, the organization think the core systems they have can do everything for them when it comes to digital front door. I mean, I'll give you specifics. I mean, Epic as a system, I mean, great product, does awesome things, a lot of capabilities, but they are not a true digital front door. They have made, portals available, but can they do everything? No. Can they be the security company? No. Can they build the trust of everything which is possible with patient journey? No. Can they connect to every possible thing which needs to be thought through in the future? No. And I think that's where, I think some organization make mistake. Yes, my needs can be met by these core systems, which are awesome for what they do. But for them to be modern and future-proof, they should consider looking at other modern applications. And as I mentioned, identity at the core. Identity platform is going to be key for them to kind of separate security and users' identity from their core application so that they can plug and play and be interoperable with many newer technologies which are coming and will continue to grow in the future. While we're doing this for the patient, without patient feedback, what we would do. So patient feedback is very, very critical. Their customer satisfaction rating is very, very critical and important, because that will make the digital front door more adaptable by our patient. So most of the digital front door we are seeing has the option to put feedback through the application. How is the experience? Did you save time? Did create the experience you needed? How easy was it for you to get to where you needed to go? How easy for you to schedule an appointment? How easy was it for you to get to your records or data you needed to look for yourself or share with your providers, even if you were outside your own town or your own demographic area? My advice is get on this bandwagon. This journey has started with many organizations. If you haven't thought about it, you're not too late, but start thinking about it and get experts. Get some experts advice, what they have done, what they have done with other customers. What are the things which are working and what are not working? Doing it yourself could cost you money, time, which could be lost. And competition is moving fast. I mean, what we are hearing from our customers is they are moving fast on this thing because it is a threat to their business existence over time, because this will take some time and you need to start working on it today. So my best advice is like get some expert help. I think the patient will have a deeper, happier experience with their healthcare. The value they will receive will be higher. They will be healthier. And I think the providers will be able to make better, quicker decisions on what a patient should do based on the collective data they will be able to look at to make those choices.